and yet another dental practice. At this stage in the game, I'm getting to know these places pretty well. And now I'm undercover, but I wasn't expecting the burglar alarm to go off.
Hello.
Hello.
Hello, name's Winter.
All right. Do you have any appointment?
Yeah.
I'll just take your details. There's a form.
Thank you.
Yet another registration form.
There we are. Do you want to rest on that? Okay.
At least she seems a bit more jolly and a bit less clinical than most dentist receptionists.
Here you are, thank you.
Okay, thank you.
Hello.
He's already got his mask on. It would at least be nice to see his face before he starts poking around in mine.
Good day.
Yeah, nice day today, isn't it? That's fine, sun's out. Have any particular problems with the teeth at all, though?
Not in the last few years, no.
Yeah?
No.
That's fine, good. If I can have a bit of a look at you, I'm going
Sure.
to take you back in the chair, okay?
He's got a bright and breezy manner.
Just let the chair take you back. That's fine, good. I'll just be touching your teeth, but we'll just be calling out what needs doing on you, okay? That's fine, good. Chart lower left 8765 present, Brad. Lower left 4 missing. 321 present. Yes, I say, not too bad actually. Yes, not too bad here actually, Mr. Winter. A couple of little bits need doing on you. So this one does need a little attention here, and possibly, although you could wait a bit on that, a little bit at the back there. I would like to touch your gums as well here a second. Okay, would you like to give your gums a proper check over, especially if we haven't seen you before?
About time they started to recede at my age, isn't it?
Not really. Not if you keep your gums in reasonably good condition, which in fact they aren't too bad here actually, Mr. Winter. There's very slight inflammation there, but besides that, actually not too bad at all. Your gums are a fairly healthy colour here, and we can't actually put the instrument down too far between your gum and your teeth. That's what we check, you see, okay? Because your gums, in other words, the teeth, the gums are well attached to the teeth, okay? Yes, I say that one in front of the crown does need a little attention.
So it's just a filling needs replacing, does it?
Yes, just slightly enlarging there. Possibly a tiny bit at the back, although that could be left, you know.
Sooner rather than later, or what?
That should be done in not too distant future there, you know. The one at the back could be left if you like, but that one in front of the crown should be done in not too distant future.
Okay.
There. Okay?
Yeah, thank you.
That's fine. If we can let you down there, okay?
Thank you.
Start to pop out to the desk there, we won't keep you a sec. Okay?
Thank you.
So he wants to do 2 fillings. More than anyone else we've seen. I've come back to question him on his customer service skills and to query that diagnosis.
That's fine, sun's out.
When I came in through the door, you had your mask on. Is that something you would normally do?
Yeah, I wear a mask all the time.
Even before I come in, you don't sort of allow me to have a look at your whole face before I lay down in the chair under...
Well, you know, I'm not that good looking, you have to see me, but I personally do keep my mask on all the time, yes. I know some dentists take them on and off, but personally I keep it on most of the time.
Those 2 fillings that you thought needed attention, could they have waited, or would you, I mean...
There's one at the back that certainly could have waited a little while. The one, I think was in front of your crown, you've got a crown there, that I would suggest needed doing in a not too distant future.
Do you think every other dentist would have made the same decision on those fillings, or could you have had a discussion with somebody on them?
Yeah, well, not necessarily. You know, people do vary a little bit in their treatment prescription, but I would have thought most dentists would have noticed that one in front of the crown, because that was, what to us, a reasonably obvious thing to do there. How are we anyway? Have any particular trouble? Anything you...
As a member of the public, how do I tell the difference between a good and a bad dentist?
Well, that's a little difficult to tell. The best thing is to go by personal recommendation. That's what everybody says, and it's as true now as it ever was. Don't pick somebody out the yellow pages. You know...
Are you in the yellow pages?
We are in the yellow pages, and so is everybody else. But quite frankly, being in things like yellow pages, or in directories, it tends to get you more somebody who's in trouble for that moment, and they want a dentist to get them out of trouble. But if you want a regular dentist, somebody's going to look after you, go by recommendation of what other people say.
Our next dentist is also a member of the General Dental Practitioners Association. His surgery isn't quite as spick and span as the last one. It feels more like someone's home, which is no bad thing, really.
Would you like to take this into the waiting room?
Sure.
As
It's round to the right of the stairs.
Right. And fill it in.
Yes, and the nurse will ask.
It's a bit confusing trying to find the way to the waiting room here.
Oh, thank you.
And when you get to it, there's not an awful lot of natural light. Still, like a lot of dentist waiting rooms these days, it's got a TV, a step up from the ubiquitous tropical fish tank, and there's always the form to keep you occupied. Looks like he's been on the same courses as the last guy. Another short wait. That's the worst part over.
Thank you. Can Becky come?
Yes,
Thank you.
Come up round.
Thank you.
It looks as though they regularly cater for kids here. If they can make children feel at home,
I'd just like
they
to
should be able to
register
cope with someone like me. He's the first dentist I've seen who isn't wearing a white coat, but he has got a very creaky chair.
Great noise.
Yes, we've had the engineer in once
Oh,
this
yeah?
week and he's coming back next week.
He's coming back with a 3-in-1 this time, is he?
Yes, I'm not sure it made a noise before he came.
Yeah.
Unlike the previous guy who never took his mask off, this one seems to adopt a more face-to-face approach.
5's got an MOD.
And there's Muzak to put you at ease.
3, 2, 1, 1, 2, 3. You're fairly fit.
Uh-huh.
You've got
There's been a lot of work done in there, though,
yeah,
hasn't there?
you've got 2 fillings that I think are needed at the moment.
Mhm.
One reasonably urgent. You're about to have a filling go fairly wrong.
Oh, am
Well,
Uh-huh.
it hurt for a while, but there's one just top left, just there, just behind the, no, just in front of the crown.
Uh-huh.
And then you've got a small one at the back, not so bad, but could do with doing at the same time.
Right. So while you're numbing...
So he wants to do 2 fillings as well.
Depending on the X-rays.
First thing I noticed when I came to see you was that you weren't wearing a coat.
No, I wear a clean shirt twice a day. I change. I've got a whole supply of Marks and Spencer's shirts.
Why'd you do that?
I think it's more friendly. We were taught when I was a student not to wear white coats. I trained at the London Hospital, and we always used to wear our shirts in those days and get a clean shirt when we needed one.
Yeah, you've got 2 fillings that I think are needed at the moment. One reason
About a third of the dentists I saw suggested that I needed work, and 2/3 suggested that those fillings could wait or didn't need immediate attention. Does that surprise you?
Well, actually, I'm surprised, yes, at those sort of figures, because one of those fillings, I would say, definitely needs attention. I'd be prepared to sort of back that up and say, let one of them have a look and feel the edges.
So you think that one's going to give me trouble over the next 6 months, likely to give me trouble over
Yes,
the next 6 months?
I would have thought so.
Here at the Eastman, they don't only train postgraduates. Dentists who've been qualified for years also come here on refresher courses, although it's a sad fact that something like 40% of all dentists do no retraining from the day they qualify to the day they retire. That means they miss out on new thinking like the need for fewer fillings. But the dentists we've seen have all been on courses in the past few years, so why did they want to do more work than our expert thought necessary?
When people change dentists, there is a likelihood that they will receive more dental treatment too.
Why?
On the face of it, it would sound that this was just somebody wanting to restore your teeth or fill your teeth for the sake of it. It really isn't that way. If, for example, I've been looking after you for 10 or 15 years, I know the history of your teeth very well. I also know pretty well by then the history of the fillings you have in them, and also your resistance to dental disease and how you look after yourself. If I know all of those factors, then I can probably afford to be a little bit more conservative. Whereas if you go to a dentist for the first time, in order that he understands exactly what your resistance to disease is, etc., he may not want to take a risk with a particular tooth early on in your relationship.
All I can say is that after the last few days, I'm thankful I won't have to go near a dentist for quite some time.